AM 1300 WMEL.
The views expressed on the following program are those of the hosts, callers, and guests, and are not necessarily those of WMEL staff, management, or advertisers.
This is Joe Steckler, folks, your host for Helping Seniors, the radio arm of Helping Seniors of Brevard County. The purpose of Helping Seniors is to inform, educate, and connect seniors and those that care for seniors to services. And I want to make it very, very clear to people, and I want you to start spreading the word to people that you know that we are not, as a matter of being in existence, in trying to compete with anybody. We are trying to complete an equation here in Brevard County. Brevard County is one of the oldest in terms of number of population over the age of 65 in the entire United States of America. We have some wonderful programs here. Doesn't it make perfectly good sense to you to have an organization like Helping Seniors that's willing to do radio, television, printed media, Facebook, Twitter, LinkedIn, all this stuff to promote the services? That's what Helping Seniors does. Helping Seniors tells you about programs like Meals on Wheels. Meals on Wheels is a federally funded program. Nobody owns it. It's a federally funded program, folks. It makes sense to me to have you better informed about what our legislators are doing and not doing. And I'm going to talk a little bit about that during the show today. But it doesn't make sense to me to have model daycares like the Social Club down in Palm Bay that Bob Weber started if people don't know about it. I started the Brevard Alzheimer's Foundation in 1995, and it was one of the top daycares around. We had one of the best respite programs in the United States. It was a free program. It cost nobody a cent. We got $150,000 from the state to run a program. We actually put about $10,000 of our own money that we fundraised for to help pay the person so that we could spend more money on services to people. Now, if somebody ever wanted to make a donation to help these programs go further, we took it. It was a smart thing to do. Nobody should have a free ride if it can afford to help pay for that free ride a little bit. So that's what we did. But we didn't go out and say, it's a sliding fee scale, or it's going to cost you this much. We said, what do you need? Can you afford to pay for it? Can you afford to help us? If the answer was no, we still did it. We did it as long as we were capable of doing it, and we didn't go broke. I had to pay staff. I had to pay electricity. I had to pay utility bills. All nonprofits do. There is really no free ride at all. We've got a couple of callers going to call in today. Kathleen LaPorte from VITAS Hospice on the second part of the show. She's going to talk a little bit about VITAS Hospice, which does the same thing as all hospices. And then Jacquie Esterline from Levin Home Care is going to call on the first part of the show because she's got something she wants to talk to you about regarding scams and hurting people. And she's got a beautiful article in our new expanded issue of Senior Scene magazine, which is the first issue is going to be out here in July. We just submitted our new 8-page newsletter to John Frederickson, who is the publisher of the paper, of Senior Scene magazine. And the reason we did it, folks, is because we have more sponsors that have information that will help you. And that's the purpose of this radio show. When I started it on December 7, 2000, it was the third radio show in over 11,000 in the United States of America that addressed senior issues. Within a month, I was offered a contract to do this show daily, 3 hours long, in Los Angeles, California. I talked to John Harper about it. I stayed right here. I had more fun. I like this radio station. I like what we do. I like helping people. I like people to be more willing to help others. And that's one of the other things we try to do. Try to develop a sense of comradeship friendship, and understanding that people want to help. Our caller is on the line, but before I do that, and I take up the whole time, I do want to remind you that we do have sponsors, and these sponsors are wonderful providers. And the first sponsors for the first part of the show are Gentiva Healthcare, the Eye Institute, Solid Bite Dental Implants, Bill Johnson, Elder Law Attorney, this radio station, Wichita Hospital System, Levin Home Care, and Jacquie Esterline from Levin Home Care is the next person that's going to be on the line with us. RenCare Medical Alert. That's the system you wear around your neck. If you fall, you push the button and get help. So don't be dumb. Use your cane. Wear your medical alert system if you need it. It's there. $29 a month. Pretty darn cheap to be just peace of mind, folks. Just peace of mind. Have that system. The Social Club and Ebony News Today. We're now featured in our fourth printed media. We got Jacquie on the line. Welcome, Jacquie. Can you hear us?
I can hear you. Can you hear me?
Yep, I can hear you. I always can hear you.
Hi, Jacquie.
That's good and it's bad. Hello.
Jacquie, I know that Kay, I'm going to let Kay take it over because I've done all the talking. People need to know that Kay, and she did drive out here to the studio with me to be on the show day, so you take it, Kay.
Oh, thank you, Joe. Hello, everyone. Jacquie Esterline, you had told me a story about a victim, and it reminded me about one of my first very calls that I had when we opened our doors in August. This lady had called me and told me that she had a pregnant lady come in after her husband passed away and lived in her home to help and assist her. Well, it turned out that lady was that pregnant woman was charging this elder woman some $2,400 a month, and she was not a CNA, not a home health aide, and turned out that she was robbed. So when you told me your story, because you're out in the streets and you were talk one-on-one with people and so forth, and because of the type of business that you're in, I think that, I want to warn the audience, too, that be sure next month in July's Senior Scene magazine, Jacquie has an article on specifically what we're going to be talking about. So take it away, Jacquie Esterline. Tell people about what happened.
Well, it is true. I get into a lot of homes, a lot of situations, and the sad thing is that more and more often I'm finding where, and I totally understand where people are trying to save money. I totally understand the need to be frugal and really conserve your funds, but at the expense of what? A gentleman that I've been talking about, I went to meet with, and here he had come in contact with one of these really sweet sweet gals. I mean, he couldn't say how sweet this person was. Volunteered to help him and his wife, who was not doing well, had pretty much been put on hospice, and they knew it wasn't going to be, very long. But this person came into the home basically for nothing, was very eager and willing to come in and help out for nothing. Well, until it was all said and done, and even before the wife passed away, this person had gotten their hands on, the savings accounts, jewelry, pretty much wiped them out. Now, what you have to understand, they did the right thing in that they prosecuted, and this person was to serve time in jail. There's also things that are done to kind of, if people are in a real pickle, there's a victim's assistance fund. But what happens is once the case is prosecuted and they've kind of made decisions on what restitution will be, which unfortunately the restitution for this, considering that it was a large amount of money and it was very valuable personally and just worth-wise expensive jewelry, the restitution turned out to be $50 a month, and the person that had come into the home didn't even have to serve jail time because they became an expectant parent, and so it was felt that they would do better paying the restitution than serving time in jail. So at that point in time, again, with all that this person is going through, they didn't even really know what the full impact was going to be of these losses. So the Victims Assistance Fund didn't come into play and had not been able to help them. Now, since that, the wife has passed away. The gentleman has had significant health issues. He's wearing a heart vest. There's a lot of stuff going on. But he's in this position now where there's no money. There's just nothing of value. He's, what little there is, TV, whatever, he's had to pawn and sell. And now, unfortunately, when I went in to talk to this gentleman, there's already another sweet, kind person that has knocked on the door and said, I can help you.
Oh, no.
And, for very little money. And it's a horrible situation because when I hear the background of the person, this other sweet person coming in, how do I stop it from happening again? He doesn't have much left. He's already, in the hole for a lot of things, and now what little is left is going to be taken again. And, I just get it just frustrates me. I hate to say you can't trust people anymore,
right?
But I've even seen it to where people in church, they think I'll go to my church and I'll post it on the, on the bulletin board that I need help. But
right,
and the lady had done that. She posted on the board. She put her name, address, phone number, what was going on. She had about 10 phone calls. I mean, happy people, really happy to help out. And to me, it just scares me because I know what the outcome is going to be. I hate to say I know the outcome, but
yeah. Well, Jackie,
need to be careful.
Absolutely. It's time and time again, it's nice to be frugal, but on the other hand, is it worth your safety and losing your valuables? And I think that the interesting thing that you mentioned in your article is what is a CNA? What is a home health aide? And if someone is going to post a little postie in their church bulletin board or whatever, or library, the question that you mentioned that is so very important is asking that potential caregiver, would you permit me to do a background screen test?
Absolutely.
And if they hesitate, there's got to be a problem.
Well,
right.
Jackie and Kay, I hear you all talking, but just remember that this all is a form of elder abuse.
Right.
Absolutely.
And so many people simply don't understand that the majority of elder abuse is actually committed by a family member. The family member manages to get their name on the checkbook. Yeah. Once your name is on the checkbook, you have free license to every cent. You can spend it all, and nobody can do a darn thing to you.
Absolutely.
You hear that a lot, don't you, Jackie?
And we had a case. Kay had a case, and she got me involved in it. It involves a lady that lives here in Brevard County, and I appeared before the Community Development Block Grant people on a Tuesday night for funding, and they asked me some questions about what we do differently from 211 and some other organizations. And I said, we follow up. We continue to try to pull the string to find out what the problem is. And in the case of this one case that Kay gave to me, I ended up calling one of the mayor's offices, and the mayor's secretary told me that she would talk to the chief of police. The assistant chief of police talked to the person. It turns out they already knew about it. They hadn't been able to do a darn thing about it because even though the guy had choked his mother, had done all kinds of things around the house, when the police got there, there was no obvious evidence of a problem. So I told the person, I said, we need to call the elder abuse hotline. She tried. She couldn't get through. I made a phone call to Tallahassee, and I got one of the top-ranked people that handled the elder abuse stuff. Yeah, they got involved. I talked to them on Friday. Saturday morning, the investigator called me and said it asked for the address of the person. I gave it to him, and she called the woman, who is actually 71 years old, and she went to the house, but didn't go to the house. The mother didn't want the woman to come to the house. She wanted to meet separately, so for good reasons. But the long and the short of it was, after I talked to the abused person, even the state investigator said there was no evidence of anything wrong. So here's a woman that's sleeping with a baseball bat, worried about her safety,
right?
And the police can't do anything. The elder abuse people can't do anything. And you keep pointing out things like that you're talking about. We know this happens all the time. But the problem, what happens, though, Jackie and Kay, is that we know that these things aren't going to be cured overnight, but if people will continue to make phone calls, to continue to call the abused people, call Kay at the office, let people like Jackie know that come into your homes that there is a problem. Eventually, you can solve a problem. And having said that, I can think of a time that when an elder law attorney got a person into a guardianship type thing, where in the process of a year's time, this man was placed in a nursing home with an around-the-clock aide in the nursing home and stripped that man of $300,000 in a year's time, and there wasn't a thing that the state attorney could do a thing about it. Nothing. So that's just, it's like adding insult to injury, and makes people like you very valuable, Jackie, when you go out and you see what's happening, how you try to get people to do the right thing. You agree?
Yeah, and that's the hard thing, Joe, because a lot of people, they're embarrassed by the situation.
Right.
And so I can't even tell you the number of times I've been in and said, have you made a call to the police? Have you called the elder abuse? Have you done whatever? And they're too embarrassed to do it because they never thought they were going to be taken. And I tell them, if you don't call, if you don't tell someone, they're going to do it again and again and again and again until somebody gets them.
Yeah.
So that's my, I understand it's embarrassing. I would never, I think, it would just be horrible to think that you would allow yourself to be taken. But, what you have to understand is that if they've done it to you, if they get away with it, they're going to go to the next house, and they're going to go to the next house. And because either, unfortunately, they're smart people. I don't know. They're driven. They want money, and they're preying on people that they feel just are vulnerable.
Absolutely.
Yeah, and that's the point of why we felt it was so important that you called, Jackie, so that people can listen firsthand to a woman that goes into home and care situations and sees this. Kay hears it on the phone. I've been getting it for 25 years. You're with Levin Home Care. That's what you all do. You go in homes to help people. And the ironic part about it is that the services you all provide are extremely inexpensive when people think about what they can lose.
Well, and not only that,
absolutely,
extremely inexpensive compared to being in a higher health facility and having people like that Levin Home Care provides to come into the homes so that those seniors can live with dignity in their own home.
Yeah.
Major difference.
Yeah. And there's so the other part of the equation we haven't even talked about is that when you go into a home, you go in to help the caregiver and you go in to help the patient also. But in addition to seeing what you go into the home for, you find out things that are other problems that actually can cause more problems that we don't even address on a daily basis. And that's why it's so important to have that other eye going into a house to see what's wrong. If you come across things, Jackie, that you've picked up on, just a quick piece of advice to our listeners.
There's just so many things. I mean, it can be the simplest of, how a bathroom is set up, or a family member. People do become incontinent as they age, and people don't understand how important it is to, change that brief. I know they're expensive, but you just can't have one brief a day, telling people and encouraging people to be, very conscious of, their hygiene when things start to happen. Because if you let that go, that's when more and more things happen that can cause, the
infection.
Hospitalization, that can cause the skilled care need. And so, there's so many things that I talk to people about. Medication management. They don't think about, how important it is to stay on that schedule or just to keep taking a medication. Just because you're feeling good doesn't mean that you should be done with your medication. If the doctor has said you need to be on it continuously, you need to be continuously. And just as kind of an aside, I know, I'll tell you, my mother, she was famous for, the doctor would prescribe something, she'd get it, take it a couple days, and then kind of it would go on the shelf. Well, and she'd never tell the doctor that it, was not working. She wasn't taking it. So if she went to the hospital, they would get a list from the doctor of things she was supposedly taking. Well, it was a 1.5 mile long list. And when she get to the hospital, they'd give her the 1.5 mile long list. And let me tell you, it wasn't pretty.
I can imagine.
You know,
oh, dear.
It wasn't pretty.
No, not at all. Well, I want to encourage our listening audience here, too. If you have any comments and you'd like to learn more about Levin Home Care and Jacquie Esterline's involvement in trying to guide you in the right direction, don't hesitate to call our office at 473-7770. We're here to help. Jackie's out on the road every day experiencing these things, and it's another red flag. Beware if you're considering having someone come into your home, because we don't want you to become a victim either.
Okay, we're short time before the break, and I don't want to get off. I don't want to shift phone calls or anything right now, Jackie. We've got you on, but you have recently accepted a position on the board of directors for Helping Seniors. I thank you for that.
Yay.
But I also want people to know that Jackie sort of represents Helping Seniors at the Commission on Aging, and you got a minute to give us a quick update on what's happening with the Commission on Aging, Jackie.
It is a quick update because what happened the last meeting was a kind of an organizational meeting. It's been quite a few years since they've actually taken a look at the focus of the group and how to carry out that focus. So this last meeting was spent entirely on outlining what needs to be addressed and how it's going to be addressed, because it's, the realization was very significant that there are areas that need to be, there needs to be advocacy for the seniors.
Yep.
And
we're out of time, Jackie.
Kind of let go.
Jackie, we're out of time. I'll pick it up on the other side of the break. Thank you for calling, and I'll see you at the office.
All right.
Okay. Bye-bye, Jackie. Bye.
Thanks, Jackie.
Bye-bye.
Folks, we're getting the signal for the break. We're going to take a quick break, and I'll finish up what Jackie was talking about, and we'll get on with our next phone caller on the other side of the break. Stay with us. Bye-bye.
AM 1300 WMEL.
This is Joe Steckler, folks, your host for Helping Seniors, the radio arm of Helping Seniors of Brevard County. Our job is to inform, educate, and connect seniors and those that need care with services. That's what we do. We try to complete the care equation. We're not in competition with that doggone person. We're trying we're in competition with somebody that doesn't want us to get people out and get the information. That's because that's exactly what we do. But my sponsors for the second part of the show are Senior Scene Magazine, Hometown News, Spotlight Magazine, Seniors Helping Seniors, The Fountains of Melbourne, Beth Courtney from Financial Advisor, Chemical Chiropractic, Canadian Meds of Melbourne, Wiedemann Malik Attorneys, VITAS Hospice, and Peaceful Beach Mediation, and I got one written down here, Barbara McIntyre from
Reverse Mortgage.
Reverse Mortgage. Thank you, Kay. It's my other part of my memory that fails me. She reminds me where the other part is. But I said that VITAS Hospice was one of our sponsors, and here's Kathleen LaPorte, who is the director, manager. You give me the title, Kathleen. What is it?
Senior General Manager.
Senior General Manager at VITAS Hospice. And since I've monopolized the show today, Kathleen, I'm going to let Kay take part of this. Take it away, Kay.
Oh, thank you, Joe. Thank you for calling in, Kathleen LaPorte. And we appreciate you taking your time, your valuable time, and speaking to our listening audience about VITAS. I think that one of the things that might be of interest for our listening audience to say that you work at VITAS. I think you told me you've been there since the beginning. Is that correct?
I have. I've been there since 2002 when we came to Brevard County. Mm-hmm.
Well, tell me about that and maybe some of the background of VITAS. What is it all about? Where does it all originate?
Well, VITAS originates from Miami.
Okay.
It was founded by a Methodist minister and a nurse, and they realized that there had to be a better way to care for patients at the end of life. So they founded what was then called Hospice Care, Inc., who has grown over the years into VITAS Healthcare is what we're actually called now, because we do provide palliative care and hospice.
Okay.
Hospice is really an end-of-life care option that places the patient in control of their care when they've been diagnosed with a terminal condition and have 6 months or less to live.
Mm-hmm.
And one of the benefits that hospice provides is that it enables patients to have their choice of deciding where they wish to spend their final days.
Right.
We're typically provided in the patient's home, whether that's a nursing home, their residence, an inpatient unit, or an assisted living facility.
Okay. Well, how can people access VITAS? As far as, I know you're out of Miami originally, here locally in Brevard County, and as you mentioned that your staff go in the home to an assisted living, to a nursing home. What really is the determining point to really contact VITAS, I think, from a family member or caretaker?
Usually that information comes from their physician or any other healthcare provider that they've been working with that determines that their condition isn't getting better. Maybe they've gone through a lot of treatments and yet they're still not getting better. Maybe for the end-stage lung patient that's been in and out of the hospital and getting more and more antibiotics and not getting better, or the cancer patient that's not responding to treatment. They usually speak to their healthcare provider who can make a referral to hospice. But in actuality, anyone can refer a patient to hospice. We just need a physician to say, yes, this patient is appropriate, and we will come out and provide care to anyone in Brevard County.
Excellent. Well, we're speaking to Kathleen LaPorte from VITAS in Brevard County, and I think one of the questions, and I think it's important to bring up, is the fact that, Kathleen, why do you think it's important for people to begin their end-of-life care planning early, or advanced directives, as some may know it?
Right. That's more, you'll hear that more and more in the media these days, because it's your right to make decisions as to what you want to happen if for some reason you were faced with a terminal illness. It doesn't mean that you're still not going to get treatment, but it's your opportunity to say what you would want done. Oftentimes, I've been doing hospice since 1986, and people will say, well, I'll let my family decide. But that's a tremendous burden on the family if they don't know what it is that you really want.
Absolutely. And I've read that there's actually a spiritual and emotional support element to hospice. Can you tell me more about that?
Sure. When somebody comes onto a hospice, they have what's called an interdisciplinary team, which is headed by a physician, and of course we provide nursing care, but we also provide a social worker and a chaplain. The social worker really is to provide emotional support and also will connect patients and families with whatever other community resources might be out there for them. And the chaplain is not somebody to come in and just preach religion, but are there to just listen and determine and help the patient and family what spiritually is important to them. So.
Excellent point.
Let me interject something here, Kathleen. So many people believe that hospice is all about the patient and death as it approaches. That is the primary reason, but there's another element in there, and it's called the ability of the caregiver to cope with the situation. And I think from own personal experience and all the hospice shows I've done over the years that one of the things that I think that is not stressed as much as it should be is the role that hospice plays in making the entire process easier for the family, not only the patient, but the caregiver itself. Can you talk about that just a little bit?
Sure. We do recognize that, once we get symptoms controlled for a patient, it really is about the family and their ability to cope with the changes. But hospice, we don't come in and every visit focus on death and dying. We focus on improving the quality of life for not only our patients, but for our families as well. For instance, one of the things that we have to support our families is that we have an extensive volunteer program where we have volunteers that can come in and sit with the patient so that the caregiver can get out, even if it's just for a few hours a week. We have a Paw Pal program where it could bring joy into a home by bringing a well-trained pet into the home to, bring a little joy to the caregivers that may be a little bit isolated. So there's lots of opportunities throughout our program to provide support for our caregivers, not only with just our social worker and chaplain, but other people visiting in the home and making things easier for them.
One of the other things that I think is so important for our listening audience to understand, Kathleen, is that we have to get over the fear of using the word hospice.
Correct.
Hospice is a good thing. It was designed, I think, primarily to treat cancer patients, wasn't it? Or to assist with that?
Yes.
Yeah.
Yes. Initially, that was the reality of it. I've been doing hospice care since 1986, so in the very early years, we did focus mostly on cancer patients. But anybody that has a life-threatening, non-curable illness, that has a limited life expectancy, can benefit from all of these services provided under hospice. And hospice is what I sometimes say is the best-kept secret because it is covered under Medicare at 100%. So there's no cost to the patient or family. We get reimbursement through Medicare, Medicaid, most insurance, and we provide services regardless of anyone's ability to pay.
Yeah, and the other thing is that I have a medical condition called fibromyalgia. And for people that don't have serious medical conditions where they hurt all the time, you don't really know what pain is. And imagine the pain the cancer patient has, or people that have really debilitating illnesses where some of these arthritic type things are actual. They're terrible pain. And I think one of the dumbest things a family can do is fail to call in hospice without realizing that hospice can help control that pain. And controlling the pain, it does enable a person to have a little better quality of life, even though they are dying.
Correct. That is really important. I've gone into homes when I started my career with hospice. I was an admission nurse, and I've gone into homes where patients were in excruciating pain, and they were curled up in a ball on the bed. And once we get their pain controlled, they can really have a good quality of life with their family. Our physicians are board certified in hospice and palliative care, so they are board certified and experts in pain and symptom management. So that's a great benefit. And in addition, having the palliative care side, where patients that may not quite be ready for hospice can access the services of a board-certified physician that is experienced in pain management as well.
The other part, Kathleen, and I'm going to ask you to specifically talk about this part of it. You mentioned the chaplain part. I don't think some people can't appreciate the value of a dying person having the capability and accessibility to a person of the cloth that they can trust and feel like they can speak to them about something that's been bothering them, unburdening something you've carried around with you with your entire life as you approach death, can be an almost insurmountable burden for many people. Pain medication and ability to control the pain oftentimes enables that person to speak to the chaplain so that the chaplain can help put them at ease pain-wise through their mind. Am I making sense?
Yes, you are making sense. You know, we talk a lot about pain and symptom management, but sometimes it is those spiritual issues or psychosocial issues that really add to the symptoms that a patient may have. So while we don't focus on any specific religion unless we're asked to, having that chaplain come on in and just providing that support and listening and being that good ear to talk about the things that have been bothering family members. Sometimes it's because they haven't been connected with other family members, and our chaplains can help facilitate that. Sometimes it's healing old wounds. So you're absolutely right, Joe.
Yeah, I found that in all my years of working with Alzheimer's patients and having hospice teams come in and assist the families in the final days and weeks of the illness. Frankly, I never had a family ever reject or say that hospice didn't help them. I just can't. I think back 20-some years, hospice always helped the people.
Right. That is our focus, is to really give back to the community, to support patients and families, to help them to have the best quality of life. You know, there's so many aspects of hospice that people don't realize. You know, there's 4 levels of hospice care that can be provided. What we've described mostly is us going into the home, wherever that may be, providing support. But we do provide respite for caregivers under the Medicare benefit, where they can have up to 5 days rest when caring for somebody. Say there's a family member getting married out of town, they can go into our inpatient facility, or we can arrange for them to have respite at a local facility so that they can get out of town and, you know, enjoy some of those things that are normal family life events. We also do have that two higher levels of care, which one is called continuous care, or we like to call it crisis care. When a symptom isn't able to be managed at home, we can put one-on-one nursing care in the home for a short period of time to get those symptoms under control, or we can bring them to our inpatient unit, which we happen to have one on Merritt Island, that we can further work on controlling symptoms.
Over the years, as you've been a hospice nurse, Kathleen, have you, let me ask, I'll rephrase, like a good attorney. I'm the prosecutor. I'm going to rephrase my question. Have you found it's one of the most difficult parts of being a hospice nurse is getting the family to accept the fact that we've got to shift from aggressive to end-of-life care?
It is. It is very difficult for families. You know, like we'll often have people say, "Oh, don't talk about hospice in front of my mother or my father," or we don't want to talk about that. And the reality is the patient knows that they're not getting better, and for everybody to acknowledge that, sometimes that's good. To allow them to get the services that they need. Other times, family members just can't give up that aggressive care. And as a society, we've become more technologically advanced. So, there's so much to offer patients that they're afraid to give up. And it's, sometimes allowing somebody to have a peaceful death without all those trips back and forth to the doctor, and just to be able to be home and enjoy their loved ones and have their symptoms managed is really a great alternative, and most patients and families eventually appreciate that. So,
Kathleen, this is Kay. I wanted to ask you more specifically, too, how do you really educate people about the benefits of hospice care? You've talked about the different levels that incur, but actually, how do you educate the public? Because that's our mission here. We've got you on this program today to try to help our listeners become more educated about now VITAS. So how do you specifically go about that, Kathleen?
We have employees that actually go to different senior centers, to community events. We create some community events that are educational opportunities. We go to family nights at long-term care facilities or assisted living facilities to educate the community about that. We do partner with a lot of community organizations. We've definitely partnered with the Alzheimer's Association, with you all, with veterans organizations, and that give us the opportunity to educate. So we have a complete staff that's just dedicated to going out and educating the community, not just about VITAS, but about all hospice care. So. Okay, excellent. Well, as a matter of fact, you are featured in the upcoming July newsletter, our newsletter, that will be located right in the middle of Senior Scene magazine. So once again, Kathleen LaPorte will have your picture in there. But your title, which I think is, I typed it into the newsletter here, you talk about advanced directives, help patients make their health care wishes known. And I encourage people, look for the new coming in July. I know we're just a week and a half or 2 weeks away, but this article is well worth reading because it will help explain further what you do and why it's important to make those advanced
directives and early, not later, so that at least they have the family and caregivers have minutes and they know the direction they're going to be taking when the time comes.
If you're too lazy, listening audience, to go to the newsstand and pick up Senior Scene magazine, take the time, open your computer up, and go to our internet, our website, helpingseniors.brevard.org, and you can read Kathleen's article, which is archived on our website. So We're doing everything we can, Kathleen, to promote what you all do at VITAS Hospice, and in turn, you are trying to help us stay stabilized financially so we can continue to produce these radio shows, television shows, all the stuff we do. A good thing, and I'm not sure if you know this, Kathleen, but we're going to, starting in July, have 11 new electronic billboards up throughout the county where have a very simple ad. It'll be our logo with I think it says senior assistance, phone number, and our website. That's all it'll be. But we hope it will trigger more people driving down the road to see what we're doing, and by going to our website, see the many wonderful organizations like VITAS Hospice, Gentiva Health Care, the hospitals, and all the things that we're doing to try to promote what's happening in the community, and above all, try to get people to accept the fact that death is inevitable. It's something we can't. It's like you pay taxes and you're going to die. It's not you're going to pay taxes and die, but those are two things that have to happen. You can't get around it. So why not be smart, Kathleen, and use the services we have available to help us die a peaceful death with some semblance of dignity?
Mm-hmm. That's absolutely right. And the more you have those conversations with your family, the better they will know what your decisions are. And just take a few minutes and put it in writing. You know, it helps your family. It supports your family. So often I see family at odds because they don't really know truly what your decisions are. So it's important that this is your time to share your voice about what you want done if you're faced with a life-threatening illness.
And in your article, when you talk about the advance directives, and Kay mentioned the advance directives, there are enough horror stories that most of us know about people that have failed to put these directives in place. It's just like using people to come into your home that don't know what they're doing. But that's another thing. All the members of the hospice team are vetted people. They know what they're doing. They're trustworthy. And that makes a lot of difference, Kathleen, with people coming into your homes.
Mm-hmm. Yes, everyone has to have a Florida law enforcement background screening, so all of our staff are well vetted. So,
excellent.
Well, we thank you for being with us today, Kathleen, and I'll look forward to our next taping session, and we'll get that probably in August. We'll get you on. We'll have another VITAS Hospice television show because we're going to be opening up a whole new series of shows on Channel 499, and we'll talk about that. And, well, we're out of time, but thank you, Kathleen, for being with us, okay?
You're welcome.
Thank you, Kathleen.
Bye. Yeah. Folks, I do want to, just before we close out the show today, that the county commissioners have given us a new time, and we're working the times out now, that we'll have a morning, afternoon, and evening show on channel 499. They're changing the channel from 199 to 499, but we'll be having hour-long shows. Well, it'll be 30-minute shows back-to-back in the morning, afternoon, and evening time, and there'll be set times. So if you want to find out more about the Care Network in Brevard County, we're going to put it there. And as it goes out to show, I'll remind everybody, if you need a helping hand, call Kay at the office, 473-7770, 473-7770. We'll see you next week. Have a great weekend. Bye-bye.
Bye.